Welcome here to Wake Up Call with Dan Tortora, on site, on location at Victory Sports Medicine and Orthopedics here on 791 West Genesee Street in Skaneateles, New York. They are here for you for preventative care as well as for surgery and of course for physical therapy and so much more. They listen to their patients, and that is why I'm proud to come here, and that's why I'm so thankful that these gentlemen are here with us today. And I feel very honored and privileged to have Dr. Marc Pietropaoli as well as Dr. Carl Calabrese with us, and we have these gentlemen that you'll hear from individually as we go, and of course you've seen their individual testimonials as well. And so I'll be back here to kind of direct everything, but Nate Coffey, I want to start with you, and just what you can say about your injury and what you took away from being here at Victory.
My injury was a pronator teres tear and partial tear to my UCL, and what I took away was met some very great people that work here, and Dr. Carl did a great job with PT. I got most of my strength back, almost fully ready to go. I started hitting today. I can throw in a week and a half, so I'm just glad to be back on track to start playing baseball again.
And Dr. Carl, what can you say about Nate's injury and what you did to try and help him get to where he is today?
Yeah, so when we first saw him after Doc did the PRP injection, our focus early on wasn't necessarily strictly at the elbow. We worked up the chain and below the chain, so a lot of the stuff we did was lower body strengthening, single leg control, trunk rotation, mobility of Nate's shoulders. He actually was pretty limited in shoulder flexion and rotation, which I think was probably a contributing factor why he kind of overstressed the inside of his elbow. So we focused on that, and now we're on a more of a plyometric program before he starts an interval throwing program.
And to have, you know, and Doc, we'll get into different things about Tommy John in general, but to see each of these gentlemen here today, and we'll hear their stories as we just heard Nate. So what can you say about, you know, kind of seeing different, it's an injury that kind of everybody groups under the same umbrella, but it's very different as far as how it's affected each of these gentlemen.
Right, so we're talking about the ulnar collateral ligament, which is a little tiny ligament, which you probably can't even see on the camera, but it's right along the funny bone area here, and it's the main ligament in a thrower that provides stability to the elbow. And it's a very tiny ligament, but very important one. And when that tears, that causes a lot of difficulty throwing. And it was a problem many years ago. It's been a problem in baseball for quite some time. And the reason it's called Tommy John is because Dr. Jobe, who was the team physician for the Los Angeles Dodgers back in 1974, he got sick of trying to treat these non-operatively, trying to treat them with repairs, and he came up with a new surgery where he actually took a tendon from the forearm, which not everybody has, so sometimes we use other tendons, but he took a tendon from the forearm and drilled some drill holes through the inner side of the elbow where the bones are, weaved the tendon through there, and made a new ligament. So when you make a new ligament, that's called a reconstruction. So yeah. The ulnar collateral ligament was reconstructed, and hence Tommy John surgery began, because Tommy John was the first one who ever had the surgery, and he did well after that. He pitched another 12 or 13 seasons, I believe. So if he hadn't done well, we might not even be talking to these guys right now. But one point I want to make is, see how young all these guys are?
Yeah.
Tommy John, late 20s, 30s, when he was having problems. This was an injury of older pitchers who had been playing for a long time. It was an attritional or a wear and tear issue. Unfortunately, since about the late 1990s, early 2000s, it's become more of an epidemic. It's much, much more common at all levels, but especially much more common in the younger generation. And right now, the most common age group of patients who undergo the Tommy John surgery are between 15 and 19 years old. So it's an epidemic, increasing in numbers, and unfortunately decreasing in age, and that's why we brought these young men together with us to talk about this today.
And Zach, to go to you, Zach Becker, about your injury, and just to describe that a little bit, how it affected you and how yours was unique as well.
I had a full UCL tear and reconstruction, so I actually didn't have the tendon in my wrist, so they used a tendon out of my leg to repair it. But I mean, the recovery was 9-10 months long, but these guys really helped me get a lot stronger than I even was before. So,
Dr. Carl, what can you say about Zach's injury?
Yeah, I mean, I think it's if I recall correctly, it wasn't one traumatic event, it was a lot of micro trauma with you where it kind of wear and tear, right? So that's actually how these things happen more often than not. It's just not a bang, there it goes thing. It's pitching with overuse, it's specializing too early, it's not having strength up top, it's not using your legs, etc. So, you know, with Zach, towards the back end, one of our focus was with single leg stability and single leg control, because he wasn't getting his leg drive involved like he should, which probably was part of the reason why he was throwing with medial or inside the elbow pain. So he worked really hard. He got back pretty early, to be honest with you, for you know, if you look at the norms. So and he's swinging a hammer now, which is putting stress on that thing, and he's doing well. So it's a testament to hard work from him.
Doc, what can you say about it?
Well, he's playing softball too now, which is good. But and he got back as soon as he was cleared. What? How many days after that you tore your meniscus in your knee? So
less than 2 weeks.
unfortunately, things like that can happen. Other injuries can occur. But yeah, Zach had the full complete tear of the ulnar collateral ligament. He did have some issues. I think, if I recall, 7th and 8th grade, you had some numbness and tingling in some little leaguer's elbow. So he had some symptoms over the years. And what we want to stress is that if you're having symptoms, or if your child is having symptoms, or if you're a coach and your players are having symptoms, don't ignore it when they're in 7th or 8th grade, so that hopefully we can get them in quick, see them. And as Carl alluded to, throwing is not just about strengthening the elbow. When we look at the elbow, we always look at the shoulder, and then we go from there down the entire body, all the way from your feet all the way up to your shoulder. Every one of those muscles and groups of muscles has something to do with throwing, and if one of them is off, it can throw everything else off, and that can lead to problems with the shoulder and or elbow, because those two definitely go hand in hand. So the fact is, he had some issues on and off over the years. He had some numbness and tingling in his 4th and 5th fingers, and there's a nerve called the ulnar nerve that runs right behind that funny bone, right next to that ligament. So when that ligament gets loose, starts loosening from wear and tear, it starts putting stress on the nerve, and that causes some numbness and tingling. So that's another early warning sign. So pain, decrease in velocity, decrease in control, fatigue, tightness. I think you had tightness, right?
Yeah.
Feeling sore, not feeling right, and then the numbness and tingling. So all those early warning signs, we want to educate people to either rest it, first of all, so you're not throwing in pain, because obviously if you're throwing pain, that's a problem.
Yeah.
But if you start having some of those other symptoms, get into people, you know, like Carl, myself, who deal with throwing injuries all the time, and there's things that Carl can talk about that we can do, which he's already alluded to get people better without end up not needing surgery, like these two guys here.
Yeah.
So we have non-surgical, we have surgical over here, and feel free to keep asking questions.
Yeah, absolutely. Kenny Peterson, I want to go to you next here and talk about your injury and you know, as Doc just said, a non-surgical injury that you had.
Yeah, so my senior year of high school, I was doing just a long toss, nothing out of the ordinary, and felt a pop in my right elbow, and I gave it a few weeks. It didn't get better, so I came in, and I had a partial tear in my UCL, and through treatment and physical therapy, I was able to come back and pitch and fully play for the second half of my senior season, after originally thinking with the UCL injury that I was going to lose my entire senior year.
And so to have that, Dr. Carl, what can you say about that? You know, not having to perform surgery and Kenny thinking the worst, and then being able to come back and play in a pretty remarkable opportunity. You know, obviously victory helped him to get that.
Yeah, so I mean, his recovery honestly was much quicker than if you look at the data for the norm. I think one of the reasons was that he worked with one of our other therapists, phenomenal therapist, but he also underwent MLS laser therapy, so he kind of got the Cadillac of the laser, which kind of increases blood flow circulation, allows that ligament to heal quite a bit more quickly to get him on the field. So I guess, Kenny, what was your take home from your time with us from a rehab standpoint? Anything ingrained in your brain as a result of seeing this that you continued with throughout your senior year?
Yeah, so I remember it was, I would be up before school. I would be here at sometimes 6:30, 7 in the morning, and before Victory even opened, and there would be doctors here to see me and help me with my treatment, and that was really the biggest thing for me, is that yeah, they were really there for me and cared about getting me back on the field.
And Doc, we hear about the laser side of things. To speak to that a little bit more, since it helped out Kenny so much.
Yeah, exactly. So what Carl alluded to is we have laser therapy here, which is kind of nice because it's basically, you know, you hear about lasers and you think about like laser eye surgery or laser surgery where we go in and we cut stuff out, which we do that. But this is more of a cold laser, so it's a healing laser.
Yeah.
And there's certain wavelengths of light that actually stimulate the mitochondria, which all you guys remember from high school biology is the powerhouse of the cell, right? So the laser energy stimulates the mitochondria to produce more energy, more ATP, which helps with healing. It also increases blood flow to the area, as Carl alluded to, which helps with healing. It decreases inflammation and swelling, so that helps the swelling go down quick, get that range of motion back quicker, and then it has a direct pain relieving effect. So as Dr. Carl was alluding to, normally when we see someone and they have a partial tear, we're going to try to rehab and get them better, not do surgery if we can get them better. And many times we can, but on average that's going to take 3 months, right? If you look at the studies, and a lot of people can get back, but it takes about 3 months. We feel with the laser treatments, we were able to cut that off by at least a month to speed it up by increasing the healing rate. So we feel as though we're getting people better maybe a month quicker than we would with just using rehab alone. And we even use it post-operatively as these post-PRP therapy, post-surgery as well, to help with the healing post-operatively or post-procedure.
And Alex Murray also here with us. Alex, to speak on your injury as well, which did involve surgery.
So my junior year of high school, I had a slight tear in my UCL, and I had to get a PRP done. Now in my freshman year of college, I re-injured it. And I had to get a bone removed from my elbow, and I had to get my UCL moved also. And right now I'm 5 weeks post-op. I have 6 months before I can start throwing again.
So for you, going through this process, what did Victory do to help the process, since yours is a more lengthy process and obviously, you know, something that you have to mentally prepare yourself for?
Right now I'm going through therapy around 3 times a week, and then I do the rest on my own time. And they are making sure I'm getting back to the field by fall time.
And Dr. Carl, what can you say about Alex's injury and kind of the timeline?
Yeah, so Alex had a little bit different surgery than Tommy John surgery, and Doc can talk about that, but it kind of goes hand in hand with what we've talked about with all these other athletes, is making sure up and down the chain he's got great mobility. So we're limited because of healing of that ligament back to the bone. So we got to make sure that he's got a nice, strong, robust shoulder, great range of motion, good neuromuscular control, and then early on at this stage we got to respect that repair. So we don't want to put too much valgus or stress on that elbow. So a lot of things that we do, cuff work, etc., we have to modify it to him to keep him strong without jeopardizing the repair itself.
So, you know, Alex, for you, how have things gone, and having to obviously keep a brace on and have to go through that, how have things gone for you?
It's gone the best as it can, and I'm limited to what I can do. I mostly have to use my left arm to do everything.
You're getting good with your left arm, right?
Yeah, which I'm not. I don't really like it, but I have to go through it.
Yeah. How are you doing writing and everything with it? You getting there?
I haven't wrote yet.
That's good. You're just texting.
But that's the thing, right? Like, you think about these athletes, you think about throwing and stuff, but Alex, you and I have had these conversations of, can I do this? Nate, you and I have had conversations about fishing, like things you don't think or appreciate throughout your daily life are significantly impaired. I mean, you had to take a different job for the summer because of, you know, having to have this procedure to protect it. So, you know, obviously financial loss potentially, as well as quality of life, on top of the, you know, losing time on the field is a huge factor for these young men. So.
And Doc, what can you say, looking at, you know, Alex's injury and kind of seeing the uniqueness of it, as Dr. Carl was talking about, that it is, you know, a different, not specifically a Tommy John, but in its own.
Yeah, no, well, first I just want to say all these guys are really hard workers. So as you can see, Kenny was coming in 6:30 in the morning. Nate's been here 3 days a week, Alex 3 days a week. Zach worked his butt off for 9 months, you know, and then tore his knee up. So so they're all really hard workers, and that's what it takes, a good mindset. So we're glad we have young men to work with like this. But in Alex's case, he had problems for 2 years. And Alex, if I recall, you were having some issues even before that, right? Occasionally with some pain and stuff. So again, earlier recognizing when something's going wrong, when there's pain, getting those athletes in sooner so we can maybe avoid the surgery. But in his case, he's young, so he has really good quality tissue. Carl's got to mold it and all that stuff and get everything working correctly. But when you're younger, you have better tissue. So what he did was his ligament was actually a little stronger than the bone, and he actually pulled a little piece of bone off with the ligament called an avulsion fracture. And that didn't heal a couple years ago. I think they tried the PRP. He was at a different place. And they tried all the non-operative stuff that we normally would try, and absolutely that's what you should always try first.
Yeah.
It didn't work on him. We repeated his MRI. That fracture had never healed, but the ligament was still attached to that piece of bone that pulled off. And even though it was pulled off a millimeter or two, that was just enough looseness to cause him pain and have him not be able to throw effectively. So what we had to do was, I went in there and I took that little piece of bone out, but his ligament was still in good condition. So we were able to repair the ligament back down to the bone with a special anchor, and then the anchor had a special piece of tape on it. It's called an internal brace. So it's a collagen dipped piece of tape that has Kevlar. It's very, very strong. Now it's not meant to substitute for the ligament. We still keep the ligament there, we reattach it, we try to get that to heal because that's going to be the real strength. The internal brace is more of a backstop, it's more to protect it while it's healing. So the ligament is still the most important thing. But what's interesting is, we talk about Tommy John surgery because that is the most common surgery for this problem.
Yeah.
And that was because of the original repairs, Dr. Jobe, Dr. Andrews, who I was lucky enough to train with, they were the pioneers in sports medicine. They were all trying to repair these, and they, maybe 25%, 30% were getting back, but it wasn't enough. So then Dr. Jobe invented the Tommy John surgery, and that kind of took off, and repairs kind of went by the wayside. But if you look at the results of those original studies, the people like Alex who had a piece of bone pulled off or had an avulsion where the ligament tore off the bone and the ligament was still in good condition, it wasn't a wear and tear injury, it was more of an acute type thing, those tended to do better with the repair. So now the last 5 years or so, we're starting to get more into repair because these younger guys have better tissue and we're trying to preserve it. And as Alex alluded to, even though 6 months is a long time, that's less time to get back playing than a reconstruction, which would be more like 9 months if you're lucky, but more like 12 months to 18 months. So a repair is going to take 6 to 9 months to get back on the mound. If you get back, because not everybody does, a reconstruction is going to take 9 months to 18 months, more like a year. So if someone tears their UCL and you do a Tommy John, you got to tell them it's going to be a year. At least you're going to miss a season. Unless you're working with Carl and you get back quicker. So the repair is something, it's a newer version of an older thing because we have better technology, better repair, better screws, better ability, we have better understanding of how to rehab it, we have laser, we have a lot of things that we can use. So we are trying to do the repairs in the appropriate situations because get back quicker, and if God forbid it doesn't work, you can still do the reconstruction. Whereas if you do the reconstruction and drill all those tunnels, you can revise it, but it's very difficult.
Kenny, kind of on a final note here, just what you think victory has meant to you? Like if you didn't come here, where do you think you would be essentially? What can you say about how victory's helped you?
I think if I never came into Victory in the first place, I would have tried to play through the injury and completely tore apart my elbow. So by Victory catching it early and getting me the right treatment, it saved my senior baseball season. And yeah, I'm always been a huge baseball guy, and it's been my favorite sport. So that meant the world to me.
And then Nate, what about you? What has Victory done for you?
Victory has really, I don't know what I would have done. I probably would have played through the injury just like Kenny would have done. Because if Will, the trainer at my college team, he's the one that recommended this place, got me in quick, and Dr. Carl and Pietropaoli, that's it.
And Alex, what about you and what Victory has done for you as you continue to go through the process?
Just like Nick said, we have the same trainer, Will. He recommended me to come here and get looked at better, or else I probably would have tried playing through it even more. And right now, they're trying to help me to get to my best, and I'd like to thank them for that.
And Zach, for you as well, what victory has meant to you in your process?
They, through the whole process, they really helped me get stronger. They really showed me what hard work can help you do, and through their knowledge, they've taught me things and how to help myself too. So,
You know, and Dr. Carl and Dr. Marc Pietropaoli here with us. I mean, you guys hear this in this moment here on the clock with Doc, a piece of Wake Up Call with Dan Tortora. To hear each of these gentlemen say that they would like to thank you for what you've done for them. I mean, Carl, I'll start with you. What does it mean to genuinely just hear these young men say, if I didn't come here, they all said it, I would have played through it?
Yeah, well, I mean, I would like to, thank each one of these gentlemen, because honestly, attitude and effort, like most things in life, takes you a certain, a good chunk of it, right? So, if Zach didn't come in, or Alex, or Nate, or Kenny didn't come in with the right attitude, the right mindset, right? What's our success rate? Or, like, oh, my elbow's feeling good, I'm 3 months out, I'm just gonna go throw, I mean, let's not do it, right? So
Yeah.
the respect and of kind of what we say to them, and willing to put in the hard work, we can show you the way, but these gentlemen are the ones that should be thanking themselves at this point, to be honest with you.
Big words coming from Dr. Carl. What about you?
Yeah, I gotta echo what Dr. Carl said. I mean, I totally agree. You can, it's who you're working with, and these guys are great. And we appreciate them coming and trusting us, and their parents trusting us. And they did the hard work, like Carl said. We can, I can repair that ligament, but Alex has got to do all the hard work. I have one day, a couple 3 hours of surgery, but they got months. And Carl, to his credit, has to work a lot of months with these guys. But they still got to put the effort in, and they all have done it. And like Kenny said, it saved his senior year, and that just makes you feel great. These guys, it was great to see Zach get back until he hurt himself, but then we fixed that. Then we fixed that up, and he's able to do heavy labor now, even with his knee. So it's rewarding to see these guys. We'll get these guys better here, and it's very rewarding. That's why I went into orthopedics, because you can actually fix people, and I love that.
Victory Sports Medicine and Orthopedics, 791 West Genesee Street in Skaneateles. To call for an appointment, call the number 315-685-7544. That's 315-685-7544. For Kenny Peterson, Nate Coffey, Alex Burry, Zach Becker, Dr. Carl Calabrese, as well as Dr. Marc Pietropaoli. This is On the Clock with Doc, and I'm very proud to be here. Dan Tortora once again. Gentlemen, thank you, and I'm happy that we got to share your stories today and see you get better. It's about our community, it's about building up the community, and for Dr. Carl and Doc over here, I know that you give credit to everybody else, but without you gentlemen, these young men would not have the quality of life they have right now. So thank you gentlemen for working so hard, and to the docs that always have the humble way about them, I want to thank you both.
Well, thanks for getting the word out there, Dan, because we appreciate that too. Without getting the word out there, people don't know.
So if you need help, you know where to come. Victory Sports Medicine and Orthopedics. We'll talk with you next time on the Clock with Doc, a piece of Wake Up Call.